Broken front tooth for the holidays. Hi, my name is Dr. Victor and I want to go over the case that happened to us right before the holidays. One of the biggest challenges in dentistry, in cosmetic dentistry, is aesthetic dentistry, and also for patients if, for example, they had done cosmetic work about a couple years ago, everything was doing well, and now something breaks. For example, this patient that we're going to talk about, we had 4 crowns done in the front teeth, look nice, very nice, but he broke one of them. And it's not repairable, okay? The tooth is completely broken. So we have the cross-section, the sagittal view of the CT scan. This is tooth number 8, and there's the fracture line over here. As you can see, the crown of the tooth is barely holding on by the gum. Patient had endodontic treatment done. There was no infections in this particular area. So the way I would like to approach this case, and patient agreed to it, is I proposed extraction, I proposed the bone graft, I proposed implant at the same time. There was enough bone to place a longer implant to anchor the implant itself, and in order to preserve the gum, very important, I wanted to do a temporary crown that's going to be an immediate crown. I'm going to put in some technical terms here. So for dentists that are watching the video, it's extraction, immediate implant placement, and immediate temporization. This is the PA of the tooth. Before the extraction, you can see here the fracture line. We removed the tooth. The extraction was difficult. We need to remove the root of the tooth, but we cannot damage the bone around it. It is very, very, very technique sensitive. We ended up sectioning this root in 2 pieces, removing it piece by piece, and we didn't damage any bone whatsoever. Next, we're placing the implant, okay? This is the initial osteotomy. We're going to check the direction of the implant. We anchor the implant more to the palatal, as we know, so that we can get a nice aesthetics on it, and the palatal bone is very, very strong. This is our implant placement, and as you also see, the implant is placed subgingivally, subcrestally, so this way when we have the crown, we're going to have a nice aesthetic result coming out of the gingiva, so nobody will be able to tell whether this is an implant or natural tooth. The implant I was able to use in this case is a 4 mm diameter and 13 mm in length. It gave us a very nice stability. As my fellow dentists know, the challenge is not to place the implant, but the challenge is to keep the gum at where it was, so this way it's all even throughout the cosmetic region of the mouth, okay? When patient smiles, so you don't see that something is higher, something is lower. Everything needs to be uniform and beautiful. So in order to achieve the best possible cosmetic result, we did what we call the GBR. It's a guided bone regeneration. It is a bone graft. In order, we placed it between the gum and the implant in order for the gum not to collapse. And also, to preserve the natural tissue, to preserve the gingiva, we placed an immediate temporary crown, which had to be sculpted and had to be done in the office at the same time as the tooth was removed. I wanted to show you on the CT scan, this is our implant as you saw in the previous x-ray, okay? This bone, it wasn't there before. This is our bone. This is what we did, this is what the GBR is called. This is the guided bone regeneration, and we placed it in order for the gingiva not to collapse. Also, this is a temporary crown that was fabricated right after the extraction. So the temporary crown that was done, he took it out of occlusion, patient is not biting on it, he's able to brush it, to floss it, but no biting on it. The final result, because he had previous crowns on the adjacent teeth, sometimes it's very, very cosmetically challenging to match the implant crown to the others. So we may have to redo 3 adjacent ones and all 4 at the same time so that they all match. Stay tuned for the case. We should be done with it soon.